Hello and welcome back to Hump Day Hormones. It is November the 26th, 2025, and we are on season 2, episode 50, and this is ear, nose, and throat. Oh my. The ENT menopause connection. So menopause is not just hot flashes and mood swings. It affects everything. Like we have talked about this multiple times. We have estrogen receptors literally everywhere. And I never would have thought of your ear, nose, and throat. But today we are so excited. We are joined by a local ear, nose, and throat specialist, Dr. Hernsberger. And we are going to talk about why you might be getting more sinus infections, sore throats, noticing changes in your voice or ringing in your ears after menopause. Those are all sort of common things to happen, and there's some true real science behind all that. So we're going to dig into things like collagen loss in your upper airway and changes in your histamine responses. But I mean, in preparing this, I was just blown away. So I really never expected all of this stuff to be the case. But Dr. Hernsberger, I know him very well because I delivered his grandbabies.
That's right.
Or some of them. Yeah, he has twin daughters.
4 grandkids.
Yeah, so I've taken care of some of his daughters, or both of his daughters while they were pregnant. And then those are your only 2 kids, right?
That's right.
Yeah. So, and then his office used to be literally across the hallway from ours when we were at the doctor's building.
That's right. A long time ago.
I know. So I've known him for a long time, and then he's good friends with Dr. Burton here in our practice. And I think y'all were talking at the lake just about me having this podcast, and you were like, hey, I talk about this with women all the time. And so, yeah, we wanted you to come on.
Glad to be here.
I know. I'm so excited. So just a little introduction to Dr. What's the H? Dr. H. Graves Hernsberger III.
So my first name is Henry.
Okay.
But I'm the third, so my dad, my granddad, they called them Henry. They decided to call me Graves. And so that's how that happened.
My husband is a third.
Really?
Yeah.
Does he go by his first name or a middle name?
I call him John, which is his, given name, but everybody in the family calls him JJ.
There you go.
Yeah. I'm the only person. It just felt weird for me to call him JJ, like that's a little kid or something.
And we sometimes call you JJ.
I know.
Because you're Jill Jennings,
I know. So, yeah. But Dr. Hernsberger graduated from undergraduate at Southwestern at Memphis in 1980. And then went to medical school at UAMS, the University of Arkansas for Medical Sciences, in 1984. He did his internship at, I'm probably not saying this, you can say it. Brackenridge Hospital in Austin, Texas, and then a general surgery internship here at UAMS in Arkansas, and then did his otolaryngology, which I know is so confusing to some people. It's ENT or it's otolaryngology, or I've heard people call it ORL. I think it's like all around the country where you trained, people call it different things. But ear, nose, and throat specialty, he did that residency here at the University of Arkansas and finished in 1989. He has a board certification from the American Board of Otolaryngology, head and neck surgery, and he's on medical staff here at Baptist Hospital, where we work, as well as across the way here in Little Rock at St. Vincent Hospital.
Correct.
Yeah? Did I get it all?
Yeah.
Yeah.
Y'all don't remember this, but it used to be eye, ears, nose, and throat.
Oh,
Back in the 50s, our academy split from the ophthalmology academy. So when you were talking about
that's interesting.
I still have older people ask me about their eyes, and I say, our specialty split 50 years ago.
Yeah.
But it was eyes, ears, nose, and throat
back
up until the 1950s.
Yeah, I guess they realized there's only so much one person. It's like we all got to get a lane and stay in it. So that was probably just all too much.
It was.
Yeah. But you practice general and pediatric. You still see kids?
A lot.
Yeah. Okay. Yeah. And you probably diagnosed multiple ear infections in your kitchen over the years, right?
Probably once or twice a week. One of my daughter's friends brings their child over for me to look in their ears. Yeah. It's fun. So,
yeah.
Putting tubes in one of their girlfriend's sons on next Monday. And so, it happens a lot.
Love that. I love that.
Yeah. Great. So we kind of already talked about your family, but you have your twin daughters. And how old are they now?
34.
34. Yeah. I thought they were about my age. I'm about to be 45. So I guess They're not.
They're not.
They're not. at that age. But we can feel that way, right? I can.
Correct.
Yeah.
You're going to feel that way for a long time.
Oh no! Oh my gosh! And then were you born here in Little Rock, or were you over in Tennessee? How'd you get to Memphis?
So I was born in Camden, Arkansas, in South
Okay.
Arkansas.
Mm-hmm.
My father was a small town doctor in a town of 1,100 people in the 40s, 50s, and early 60s. So I went through first grade in a little school in Stevens, Arkansas.
Uh-huh.
Oh, okay.
And then we moved to Topeka, Kansas for a year. He decided to change from primary care to psychiatry. We went to the Menopause Foundation in Topeka, Kansas, which was a famous place at the time. He did an internship year there. Then we moved here in 66, and he stayed on at the university and at the state hospital as a psychiatrist over there. But so I've been in Little Rock since basically third grade.
Yeah. Okay.
Yeah.
And then you went over to Tennessee for medical
Just
school.
for my
Yeah.
college. I didn't. My brothers, my sister went to Hendrix, and I wanted to go to a small school, and I didn't want to be John and James Hernsberger's little brother. So
Yeah.
went to. It's now called Rhodes College.
Oh,
So
okay.
Southwestern changed its name because it was getting confused with UT
Oh,
Southwestern
right.
in Dallas.
Oh, okay.
And so
okay.
they changed the name to Rhodes College probably 4 or 5 years after I left.
Oh, okay. Yeah,
Gotcha.
because they're all in the same, like I went to Hendrix and they were all in the same conference, Rhodes
Correct.
and Southwestern and all those.
Yep.
Yeah, that's who we played in sports. And now they have football at Hendrix.
Yeah.
They didn't used to have that. So, and then the obvious question you have to ask any doctor is, why'd you go to med school and why'd you pick ENT? I feel like people ask me that all the time. Why'd you pick OBGYN?
So the why be a doctor is pretty easy. I think my dad subliminally did it to him because he delivered babies in people's homes and all that. And then he would make some rounds in the countryside. And when he knew it was all going to be good, he put me in the car with him and I'd go. And it was just like, this is the coolest thing.
So neat.
And I'd go to his office. And then I loved biology and science was easy and it was just an easy path. So, and then ear, nose, and throat, it was going to be between general surgery and ENT. And I worked for a guy who's deceased, Reed Thompson. I worked for him a month, the first rotation of my senior year. At the end of that month, I asked him 4 or 5 questions and he answered them right. I said, well, I think that's what I'm going to do. But the big one was go by the parking lot over at St. Vincent's on Friday night, the doctor's parking lot, and look
Yeah.
at the cars in the parking lot. If you want one of those to be yours, you need to be a general surgeon. If you don't want
Or an
to be
OBGYN.
or an OBGYN, yeah. And so anyway, but in the variety of it, there, other than the brain and the eyes, you know, everything from here up is sort of our realm, and it's
Yeah.
fun and interesting and diverse. So that's why I picked ENT.
I don't feel
Love
like you
that.
get a lot of training on that. It's still like, I mean, it's one of the elective, like you have to pick to do it as an elective in med school. So it's
You
not.
might get 1 or 2 weeks in medical school.
Yeah, you do. You
So
really.
it's a black box to most
You'll
people.
need to unlock your iPhone first.
That's true. It's true that it is. And I mean, that makes even more sense that it's like the nuance of the nuance of the nuance. If you think about, okay, then you've got ENT, then you've got women in the ENT, and then you've got menopausal women. It's like, man, no wonder like nobody knows about estrogen issues with the airway because nobody's talking about menopause in med school in general. And then,
No.
you're barely
Right.
getting ENT training. So it really is, you know.
The only, even in my ear, nose, and throat training, rhinitis or pregnancy was the only thing that we talked about related to women's health.
Yeah.
Being different or hormones.
That pregnant women have
and they all get
rhinitis.
congested, and we think it's safe to use steroid nasal sprays.
Okay.
And that was it.
That was it. Yeah.
And so it was
Yeah.
5 or 10 years into practice. And then after that study in 2002, that I started seeing a pattern of all these women in their late 50s and 60s. Every now and then I have a student follow me, and I go to the door and pull the chart out, and I look and I said, this is a 61-year-old female. I'm pretty sure I know why she's here. And you walk in. I'm stuffy. I have a lot of postnasal drainage. Fragrances bother me if I'm around fumes. My nose burns, you know, and I go, what's going on here? Why do they have all these symptoms? And then you start putting 2 and 2 together. They all got their hormones taken away from them after that study in 2002.
Yeah.
And so
That like
It's been a
blows my
frustrating
mind that
session.
you've seen that. You
I
know, that
know.
connection.
and that was, you know, 10 or 15 years after I was in practice.
Sure.
But it seemed like back then, the majority of women in this city were on Premarin or Prempro.
Mm-hmm.
No one was on estradiol or any patches.
Mm-hmm.
They were on Premarin or Prempro, and then all of a sudden it stopped.
Right. There's like, the rug was literally ripped out from underneath them. Yeah. And then, just the changes. And I feel like if you're from like an old school doctor family, you understand this. Like your patients teach you what they need. And that's why like I got into hormones and kind of got Courtney on board because like we were seeing so much of that in my practice. It was like every woman was here with the same complaints. And I'm like, okay, there's more to this than just, this is what getting old is. I mean, that's not an answer. It's not an answer from your doctor.
Well, they call it the practice of medicine for a reason.
Yeah.
And if you pay any attention at all, you get a lot better as you get older and you start observing things and figuring stuff out that you really weren't taught. That just becomes common sense after a while. Mm-hmm. But it's very common in my practice, and my staff through the door, they hear me talking about this all the time.
Well, we
but the
love
fact
that.
The fact that the tide has turned is a great thing because it's causes a lot of misery for a lot of women during those throat issues.
And then now they're unboxed, right? I mean, we have no black box warning. We still have to be cautious. We still have to use them in the right people. We still have to counsel women on, they still have risk and the abundant benefits, but it's not just like, oh, the black box warning is gone, hormones for everyone. But I feel like that giant stigma around they're the scariest thing, is gone. So hopefully the trickle down is going to be that we get training.
But when physicians felt scared to prescribe it because of the warnings, as an observer of your profession, none of y'all wanted to talk about it.
Yeah. Right.
Because it could be an all morning discussion with every woman that walked in the door.
No, that's right.
And so it became a blanket answer. No, it's not safe. We don't do that. And then move on to something else.
That's right.
When they're still sitting there complaining about their symptoms. And so it was interesting to watch all these frustrated women. So that's the whole biomedical hormone industry popped up and all these little things popped up trying to solve something. But now we're back to where we should be.
I know. And I think what's going to have to change down the road, and this is a whole nother conversation, but is like, we're going to have insurance reimbursement around the time, because women do deserve the time to talk about, why were we where we were with hormones, and why are we where we are now, and why should I take them, and risk benefits. And that takes time, but it can't really be done in your annual. And that's why we kind of came up with this hormone, like, come here and let's just dedicate the time to talk about your symptoms and your treatment options. But there's going to have to somehow be reimbursement for that. Or, doctors work for profit. And so, nobody's going to want to do that if it doesn't.
Very time consuming.
Yeah. And so that's why, like you said, it's easier just to kind of shut the door on it and move on, because if you're focused on getting people in and out of clinic. So we encourage people all the time, if you want to talk truly about your hormones, make appointments specifically for that. And
I've sent a few people to you when I figured out you like this.
I love that.
Hey, I had one of your patients last week that said, I'm only here because he sent me. And I was like, great. I love that.
I know. And I love getting other specialties involved, because it's one thing for me to be excited about it, but if we've got all the other specialties kind of on board too, and like you were talking about some family practice doctors. So I think we'll get there. We're in the middle, or really at the beginning of a head to toe menopause series here. We did kind of the brain and the hair, and now we're doing
ENT
ear, nose,
stuff.
and throat. So one of our favorite segments here is Did You Know? And it's just random kind of either statistics or facts about the subject that we're talking about. So did you know that estrogen affects your airways, your sinuses, your mucus production, your saliva, your voice, your hearing, and your snoring? I'm sure you did know that.
See it all the time.
Yeah.
And then here's another one. Estrogen influences how well our immunity and histamines work in our sinuses and other places, like in our guts.
Yeah. And so without that
I did not know.
Yeah.
And I'm going to start paying attention to that on women who are on pretty good doses of estrogen to see. But I never really have observed that some women on hormones have more nasal symptoms or allergy symptoms because of elevated levels of histamine. I've never really seen that. So,
and now there's this big push coming out with mast cell activation syndrome and kind of maybe the connection, like in perimenopause when we're so volatile with our estrogen production, that they're seeing that more in that space. So it's so interesting. But did you know that we have estrogen receptors in our vocal cords? I think that's crazy. Like just a tiny little, I mean, I know most people listening to this podcast have never seen a vocal cord, you know, like we've seen a vocal cord, and just how tiny they are. But then if you have any appreciation for like musicians, the massive amount of like talent and that can come through those is pretty crazy, like how all that noise is made just from those two tiny little cords, and just that they have estrogen receptors blows my mind.
So vocal cords are mucous membrane, and all mucous membranes have estrogen receptors.
Yes.
And you're talking about voice. It's an interesting story. I once had a man who was 67, sang in a quartet, and over about 6 months to a year lost his voice. And we're sitting there talking, can't find anything wrong, but his vocal cords are kind of thin, atrophic, not the big, thick, lush vocal cords that you'd want to see in someone who's a singer. And as an aside, I said, have you ever had your testosterone level checked? So the same thing happens to some men.
Yes.
It's more prevalent in women, but the same thing happens. And so I said, you ought to get it checked. And if it's low, you ought to consider supplementing it, because you're telling me of this thick mucus and phlegm you have. You're telling me your vocal quality is just nosedived. And sure, that happens to a lot of singers in their 60s. But this is one thing you can do something about. He made an appointment and came back to see me 6 months later. I walk in, hey, how are you doing? And he goes, I'm just here to thank you.
Oh.
Changed within 3 months. His testosterone was almost zero.
Sure.
And so that was a profound example,
Yeah.
or an extreme example. But many men, the same thing's happening to them with andropause, loss of testosterone, as is happening to women.
Yeah.
It's just more common, I think, in women.
Yeah.
Yeah, and I think too, it shows that like that everybody has one symptom that's gonna like, okay, this is it. I could deal with the hot flashes and the night sweats, but I cannot deal. Like we see it a lot with brain fog. I cannot deal with this anxiety and this brain fog. It brought me in to talk to you. Like I can't do my job anymore. My brain is so crazy. And so it's like for men, I mean, I wonder how bad he was feeling with energy and muscle just all over his body and his sex life and everything. But like his voice was so important to him because he was in a quartet that's what the straw that broke the camel's back for him. I think, he probably felt so much better in his whole life and relationship and everything. So yeah, that's crazy. I love it. Yeah.
I love it.
And then that men's testosterone is such a slow, gradual fall as opposed to our like cliff in menopause. So that's probably why it's a little bit different in men and women too. Just that y'all don't have a cliff.
We don't. It's a gradual thing.
Yeah. And then according to the journal In Menopause, about 46% of menopausal women will report voice changes like hoarseness, vocal fatigue, or altered pitch. And about 1/3 of those have associated vocal discomfort. So, I mean, this is well documented in medical literature. Yeah.
Their vocal folds, which are mucous membranes, get thinner. The cords, instead of being perfectly straight, as they get thinner, start to bow. And so their ability to project diminishes. And to project like they want, they have to work harder, and that causes strain. And so if they have to speak for long periods of time, at times their voice will fatigue.
Wow.
And so, and for women that like to sing, gosh, in the last year, I've gone from a soprano to an alto. And a lot of those are age-related changes. All this is mixed up with age-related changes in genetics and all that. But many of these women, I will mention to them, have you ever had your estrogen checked? They're 61 or 62. And this brings up the subject. if they went through menopause at 50, is it still safe for 62? And y'all probably can answer all those questions.
Yes.
And it may be, but,
Yes,
and those
it
are
is.
questions I don't know, but,
Yes.
you know, it's unfortunate, you know, and is it reversible if they started back on hormone replacement? Would their cords lush up if they hadn't had hormones in 12 years?
Right.
And all of those things.
Well, and we do know, I mean, to bring that up, I mean, we do know in other places, like if you take estrogen away, you will somewhat lose the receptors. Like our bodies are smart to know I don't have a lot of estrogen like in my vagina, so I'm not going to have as many estrogen receptors. And it takes a while of using the estrogen to build back up the receptors in order for it to work on the tissue.
Right.
You know, so
You think they would build back up over time?
I think they would, but I think it would take a while.
Right.
And I think you'd have to follow their levels and make sure that they're getting like good levels. I mean, because just to give somebody estrogen and then, you know, now there's this big push about use the very lowest dose. It's like, well, just to put on the very lowest dose of a patch, I mean, sure, is saying that you're on estrogen, but are you on sufficient estrogen? Like, is your estrogen level getting high enough to even cause effect? You
Because
know?
in men, they target that low normal level of testosterone and try to be above that to some degree. You would think you would want that to be the same.
I think that you have to follow levels. I think that's really important. I think if you feel, I don't think everybody has to have the same level. I don't think everybody has to have a level of 100. I think if you feel great and your level's 52, awesome. And then there's going to be some women who don't feel good till it's, 150. But I think that, we don't need to have an estrogen of 20 and say that we put somebody on estrogen. It's like, no, it's still a postmenopausal level of estrogen.
Yes.
Everybody's absorption and all that is just different.
I think we have to follow levels. But I also think that this brings up a really interesting point in that Taylor Swift is really going to need us, right? Because she's going to need me to have her babies. So if anyone's listening, and I mean, we can deliver her babies. My daughter wanted to know if she was going to come to Arkansas to have her babies. I mean, probably not. And then she's going to need us because her vocal cords are going to change.
That's right.
I mean,
That's right.
and it does bring up a good point,
She won't
too.
need me, though. She's got you because you're going to make sure she gets postmenopausal hormone replacement therapy.
Essentially, Taylor, you just need me. I mean, that's where we're going with this.
I want to know, Dr. Hernsberger, what are women's responses whenever you say, hey, I think this might be hormone related, or like...
A lot of them just sit there and they are processing it all.
Sure.
Because they come to me with a dry, stuffy nose, postnasal drainage, which postnasal drainage, everybody thinks, well, it's allergies or a sinus problem. It never is. It's always a dryness problem.
That is so, I wrote that on here because I was so like...
So in the normal situation, your nose
produces
produces 2 or 3 pints of mucus a day. Most of that's evaporated to humidify air. But the rest is thin and watery. The cilia sweep it to the back, and you're swallowing all day long, and you're unaware of it because it's thin, clear, easy to manage.
2 pints?
2 or 3 pints
I
in your
mean,
nose.
that's so much.
3 or 4 quarts of mucus and saliva in your mouth and throat every day.
Gross.
And you're swallowing. Start paying attention. You're swallowing little teaspoon-sized globs of saliva and mucus all day long. And so when it's normal, it's thin, it's watery, the cilia are working, it's clearing, you're drowning in mucus and you're unaware of it. So when you become aware of it is when you're drier. And there's snorers. Their throat collapses, the body's response, their mouth pops open, they wake up with a very dry mouth, dry throat, thick mucus in the airways, and they probably are sleeping under a fan, they probably have obstructive sleep apnea. And they wake up all chugged up, all this drainage with no air going through their nose for 6 or 8 hours. All the clear mucus that was there to humidify air doesn't get evaporated. It's swept to the back. So they wake up with a snoot full of drainage in the back of their nose. Say, gosh, my sinuses just drive me crazy every night. Has zero to do with their sinuses. Has to do with mouth breathing at night.
Wow.
Well, or a postmenopausal woman. She's just dry. She makes dramatically less mucus. She did. Instead of thin, watery mucus, it's thicker, more viscous. And then rheumatologic diseases, Sjogren's, women or men who are on diuretics or antidepressants, women who are on bladder spasm medicines. Like
oxybutynin.
Oxybutynin dries them to a crisp.
Yes.
They're already dry. and
Wow.
postmenopausal, no estrogen, then someone puts them on 5 or 10 milligrams of that,
Mm-hmm.
now they can hardly swallow because their airway is so dry. So postnasal drainage is a dryness problem, regardless of the cause. When you have allergies, it's lots of thin, watery mucus, and you're blowing out of your nose, but you don't feel it going down your throat.
Sure.
So what happens to most patients? They go to someone complaining of postnasal drainage. They prescribe antihistamines and steroid nasal sprays, which does what?
Dries you out
Dries
more.
out even more. Yeah.
Yeah.
And so it's these women come complaining of stuffiness, congestion, drainage, maybe voice changes,
Yeah.
dry nose. They also have dry, itchy ears
Mhm.
because they don't make any of the oily secretions or cerumen to keep their ears moist. They all have dry eyes.
Mhm.
Many have been to rheumatologists and ruled out Sjogren's syndrome. And everyone's baffled as why they're so dry. And their ophthalmologist has them on eye drops.
Yeah.
So
It took
you
me
need
10 years.
estrogen.
It took me 10 years to saying you probably also have vaginal dryness. As everyone's a throat doctor, I wasn't comfortable telling them.
Like, why are you
asking
talking
women.
about my vagina?
And they go,
Uh-huh.
oh, I'm on a vaginal estrogen preparation.
Uh-huh.
Just like half of them. They're on a
Wow.
vaginal estrogen preparation. But no one's thinking that all of this is from no
Also
estrogen.
mucous membranes.
And it's also common sense because it's all a mucous membrane. It's
Correct.
the exact same tissue on the inside of your mouth as it is on the inside of the vagina. I mean,
Uh-huh.
just from a straight up biology perspective. And so, yeah, just like the vagina, the urethra, the bladder. I mean, we all, that's a very well accepted by everyone phenomenon, the genitourinary syndrome and menopause. But like, we got a whole ENT syndrome and menopause too.
Big time.
Yeah, that's, I mean,
Big time.
it really
Yeah.
is just common sense, but then it's like not that common.
No one gets trained on that in residency.
Mhm.
Yeah.
And there again, these are seemingly trivial. This isn't an infection. This isn't a cancer.
You're not going to
Mhm.
die.
You're not going to die from
Yeah,
it.
yeah.
Mhm.
They're in many physicians' lives. I think they're looking for all of the bad things.
Right.
Hey, everything looks good. I don't see anything wrong.
Mhm.
Without taking it one step further and go, but why? I
Yeah.
see 10 women
Yes.
this week with these same symptoms.
Right.
And that's what happened to me in the 4 or 5 years after 2002 when that
Yeah.
WHI study came out.
And I think,
That's wild.
yeah, we all want to catch the big cancer or, we don't want to miss the big things that are going to kill someone.
Mm-hmm.
But I think truly the day to day is like we can have these little impacts on people
Mhm.
that affect their overall quality of life, like the guy in the quartet. Or if your deal is singing and you're really, really into that,
Mhm.
I mean, and you retire, that's a big quality of life thing. That's a hobby. That's something that is really important to you.
Mhm.
And so, and then, yeah, to your point, I mean, if you've got a dried out throat and nose and ears, then yeah, your vagina's that way too. So what's your sex life like? I mean, all that stuff. And it's
all tied together.
yeah, also quality of life important. And as we get better and better with medicine and we're all going to live into our 80s or, maybe hopefully 90s, we want to do that in a good quality way.
So there's nothing worse than the woman I see that had total hysterectomy at 32. She took hormones for 6 months to a year, and then there was a problem getting it, insurance, or the doctor decided, you really don't need that. And they're 82, 50 years later.
Oh, yeah.
Their mucosa in their mouth and throat is so paper thin. They're so dry. They have very little mucus. What they have is this thick, sticky, viscous stuff. They're always clearing their throat because it hangs on their vocal cords.
Ugh.
And it's just, I don't see how they've done it.
It
Wow.
really is just a tragedy. And
It is.
I will have like 99 problems getting older, I'm sure, but this will not
Will
be
not be
one.
one of them.
This will
Yeah, this whole generation of women that are
Yeah.
approaching menopause are going to know.
Yeah,
And your profession is going to be more proactive about doing it,
that's right.
Right.
That's right.
which is great.
Yeah. So we know low estrogen is a problem, but I think it's interesting because like this is a phenomenon with everything. High estrogen, it's like the balance is what's good because too much is not good. Like we just talked about that pregnant women get all stuffed up. And really, if you're like the science behind that is the progesterone, it causes swelling in the sinuses. So it's sky high when we're pregnant and we get all the pregnancy sniffles is how we're taught them. And then nosebleeds. I know we had to send a couple patients across the hall for you to cauterize vessels because they get this vascular engorgement that's likely due to like their really sky high estrogen. So yeah, too much is not a good thing
either. If they had any
either.
propensity to have a nosebleed before, if they get the rhinitis of pregnancy and all that vascular engorgement from those hormone levels being so high, they're going to have a worse problem during pregnancy. So not uncommon. Have to cauterize and fix the spot.
Yeah. Yeah. Okay, so we've talked about that sinus congestion is more common. We talked about the
It's actually
postnasal.
not sinus congestion.
Well,
it's nasal congestion.
nasal
So
congestion.
the nose is one organ. You breathe through it.
Yes.
You have turbinates there that increase the surface area to warm and humidify the air that you breathe. And then aside from that are these air-filled little pockets.
Right.
And so the sinuses are sort of one set of organs and the nose is a different organ, right?
Yeah.
And so people say, I have sinus congestion. Well, you probably don't. You have nasal congestion.
Nose congestion.
You have nasal congestion.
Okay.
So it's your nose what you breathe through. You do not breathe through your sinuses.
Okay.
And so people are very confused about that.
I'm still over here thinking about the pints of mucus that I'm making as we speak.
All day, every day.
Which is a good thing. You want to be doing that.
Try.
I know.
Yeah.
Well, and it's not, I mean, we as surgeons sometimes deal with an ileus postoperatively, that where your bowels lock up. And so we have to put NG tubes down to deal with these liters of fluid that your gut are making that have to be processed. So it's that same sort of phenomenon of our body are just doing that job and we don't even know it's happening every day. We just take that all for granted. But yeah. And so are we more likely to get allergies because of all this, or does it just feel like allergies because we're more stuffy?
So this is a good question. So I'll see that 60-year-old woman, and she's been to the allergist.
Yes.
And she's not allergic to anything.
Yes.
So they've
had testing.
What's the allergist call it? We have non-allergic rhinitis.
Right.
But what do? They give them a couple different nasal sprays
right.
that
And
dry them out worse.
Yes.
So she'll kill me if I said this, but I had an allergist in the office and we went through all of this because she's having all of these symptoms and her gynecologist has not put her on hormones because she went through menopause 10 years ago and she's complaining with her nose being stuffy. I said, well, I asked her, what is it? She goes, it's non-allergic rhinitis. I said, what is that? She goes, I don't know. I said, you diagnose people. Your profession diagnoses everyone who you allergy test and they have nasal symptoms and they have no allergies. You call it non-allergic rhinitis. Tell me what it is. She goes, I don't know. I said, well, how could you diagnose someone with something you don't know what it is? I said, it's a dry nose. You look up, instead of healthy, moist, pink mucous membranes, they're dry, red, inflamed, crusty. And these people have dry, stuffy noses. She goes, well, that's what I have. I said, I call it chronic dry rhinitis. It's a chronic dry inflammation in the lining of the nose. And it's difficult to solve. We might as well talk about it now. I think you've got it on the list. Because I can't make those women produce more thin, watery mucus in their nose.
Right.
And so they, one, stop sleeping under a fan. Two, they love how their nose feels after a long, hot, steamy shower. And if their nose gets really, really feeling bad, hot, wet wash rag at the sink, wring it out, breathe that hot, humid air. But probably 75 years ago in this city, an ENT doctor, Dr. Tom Smith's father, who practiced in the Donaghy building downtown, came up with a concoction called oily nose drops. And these women love them.
Yeah.
And it's a little mineral-based drop and a couple drops in each nostril when they go to bed at night, and they don't wake up stuffy and congested the next day. Pulmonologists fear that some of that mineral is going to get in the lungs and cause a pneumonia problem. But I've never seen it, and I've been prescribing them for 35 years, and they've been going on for 35 years before that. But it's a compounded thing that a few pharmacies still make. And they use a couple drops of that. If they're afraid of that, one of the over-the-counter antibiotic ointments is petroleum-based, bacitracin, a little glob of that, and lube up their nose at night. And they don't have this dry, what I call pissed-off nose.
Yeah.
And so, and as a consequence of having dry noses, how many 70 to 80-year-old women do you see walking in with a Kleenex in their hand?
Yes.
Yes.
The Meemaw has always got the Kleenex in their purse.
So why do you think they do?
Well, I mean, Meemaw's
Are they
97,
spitting out that
and
thick
she's
stuff?
she's always got that
They're
clear,
always
clear water drip.
yes.
Just dripping.
So it's called
Yes.
vasomotor rhinitis, and vasomotor meaning that it's the vaso probably doesn't make sense, but it's an autonomic response to the dryness. These women have been dry since menopause.
Oh
Their
my
brain
gosh.
It senses how dry everything
Like,
is.
let me help you out.
And their parasympathetic nervous
Yeah.
system tells all their mucus and saliva glands get to work, but none of them work because they're all dried up from no estrogen for 20 years, except the little mucus glands on the front of the inferior turbinate that make the moisture.
Wow.
To keep your nose moist, they must not be estrogen sensitive. So they have all this outpouring of autonomic activity to produce more secretions, but the only ones that work are in their nose, and they walk around with a chloride drip. Happens
Yes.
some in men. Had a
Wow.
84-year-old guy in the office the other day. That was his only complaint. For a year, my nose has been dripping. I looked at his wife, and I go, I see you've got a Kleenex. Oh, I've had it for 20 years. And so this is another side effect of having
my
dried
gosh.
up glands from their estrogen. They all get vasomotor rhinitis, which is the clear watery drip thing. And so it's crazy because they have a clear watery drip, but right past that, their nose is dry and stuffy. It's crazy.
Yeah, I mean, our brains are trying to like help us, you know. But yeah, I do think it's interesting, like you're saying, the non-allergic rhinitis. I mean, it's like us saying that everyone who doesn't ovulate has PCOS. Like, no, they don't. You know, we just don't know what other bucket to put them
Or like
in.
unexplained
Or like-
infertility.
Yeah, like, why
You know,
aren't
it's
you
like-
ovulating? Let's just not
So-
call it PCOS.
so
Why do you have
you've
PCOS?
got to figure that out.
Yeah. Well, they have PCOS because they're insulin resistant most of the time. Most of the time. That's the bottom of it. But people don't figure that out. They just say, well, you're not ovulating, you have PCOS, get on some birth control. Birth control pills don't fix your insulin resistance. They, in fact, may make it worse. So, yeah, it's like the same phenomenons that are happening in your world where people are like, here's some histamines to fix your runny nose, which actually make your dry nose problem worse.
And antihistamines, yeah.
Yeah, yeah.
So back to the deal that if you're on too much estrogen, your mast cells are producing more histamine and you should be more allergic.
Yes.
I don't see that. All I see is dry noses.
Okay. Yeah.
Wow.
I don't see puffy, buggy women sneezing all the time from the release of histamine from this mast cells. I just don't see it.
Yeah.
I'm going to start looking for it because there may be an occasional woman who has it.
Yeah.
But all I'm going to see is women with no estrogen.
I know.
Wow.
I think,
and dry
Dried up
everything.
noses.
and I think that's where they're talking about it now, is that estrogen on board helps modulate that mast cell response to like release the histamine. And so you take estrogen away and you get this over response of the mast cells. Because estrogen's not there as like the damper on those. And so, but perimenopause is a giant problem because sometimes you have surging estrogen and then sometimes you have none. I mean, all in the same week or for sure month, you know? And so I think people will notice like that stuff gets worse like around their period. Well, you have no estrogen on your period, you know? And so it's easy to track that when we have that visible outward sign. But when your period goes away because you've had a hysterectomy or an IUD or an ablation or whatever, it's harder to track that.
Yep.
Yeah. So, okay, let's talk about, we kind of talked about snoring, that kind of the more congestion, more mouth breathing, dry mouth, and sleeping with a fan, maybe because you're menopausal and hot flashing and night sweating. But there have been studies that show that sleep apnea increases 2 to 3-fold after menopause, even when your weight stays stable. So I feel like we're, you know, tuned into thinking about you got sleep apnea because you were overweight, but it's like, yeah, I mean, women wake up and they feel like they've got headaches, they've got dry mouth, they had night sweats, I slept awful. This is just menopause. And then meanwhile, they may have sleep apnea, which we know like long-term increases your risk for heart disease and all those things. Yeah. So kind of that full metabolic syndrome.
Like the hearing issues we'll talk about, it's a multifactorial problem. All of us are going to be more and more likely to snore as we get older because our anatomy changes, you know, our vertebral bodies and our cervical spine, the disc we start losing height there. Everything's going to become more crowded. All of our tissues of our throat get more lax and collapsible as we get older. But if you have a woman who has zero estrogen and their airways dry and becomes inflamed from getting dry, or that thin atrophic mucosa gets more lax and collapsible, that's probably the association. That's the only one I can come up with. But many people, it's just getting older and maybe gained 5 pounds.
Right.
And they just tip over. They never snored until they were 55 and they started to snore a little bit. And that has to do with the anatomy they inherited from their parents. Okay. If you inherit a real deep, wide open throat, you may never snore until your 70s. But if you have a flat, retrodisplaced epiglottis, your tongue base is a little back, you have a little bit of a short chin, which is holding your tongues forward, you can look across the room and go, that guy's got obstructive sleep apnea.
Wow.
Dark circles under his eyes, which are from mouth breathing all night long. And so, you know, some of they're allergic shiners. Well, if you have allergies so bad you can't breathe through your nose, but you mouth breathe all night long, you wake up with dark circles. And so when you see dark circles under somebody's eyes, they probably mouth breathe all night long, and they might be an apnea patient.
Wow.
But short chin, tongues back.
Yeah.
If they inherit a flat epiglottis, it's like a trap door rather than a curved one. They're more likely to have this. So I think the hormone connection is plausible, but there's so many other factors that relate to that.
Yeah.
But women have to be cognizant of the fact that wake up and feel like crap every morning. You have to ask your spouse questions,
right?
Your partner questions. You know, you say I breathe heavy at night. Well, do you ever hear me struggling to breathe? Do you ever hear me have a gasping breath? The brain arousing you to get your airway open because your O2 sac got too low. And the answer is yes. It's time to have a sleep study. I probably send 5 people a week for sleep evaluations.
Yeah.
They're coming to me complaining of, I have the worst sinuses every morning. I have a band-like sinus headache, have all this drainage, all this congestion. My sinuses just wear me out every night. They got bad apnea.
Yeah.
Wow.
Well, and then you hope that someone at the apnea clinic is talking to them about, did you know all that can go into this? And did you know that maybe your estrogen could be involved? That's a far shot, right? Like
Far shot.
Where
I think
probably it's
more
never
obvious.
getting mentioned.
There's going to be more obvious
Yeah.
symptoms of no estrogen than the snoring connection. Probably.
Yeah.
Yeah.
But is
And
there
like-
probably some loose connection? Yes, but I don't think
Yeah.
it's
And like, what
Yeah.
can you do to help your snoring and your sleep apnea? I mean, it would just be awesome if it was just on the list, even if it was number 7
Sure.
on the list,
Sure.
you know, just on the
Like,
list
did you
of
wake and
like,
feel rested in the mornings? No,
Yeah.
never. What a lot of those women didn't sleep because of their menopause. But
right.
They got to ask their spouse questions.
So you
Yeah.
can like pick who you're sharing the hotel room with from like across the room. You're like, short chin, dark circles.
Yeah.
Like, not that person.
Over sharing hotel room.
Yeah.
Period. Because everyone in my age snores
Yeah.
to some degree.
Oh my gosh. Okay.
I know. I feel like I'm just going to be looking at people different now. I feel like that you snore. You didn't sleep good last night.
We were on a trip and we had 3 trip leaders. It was a backroads trip. And one of the trip leaders was a previous professional soccer player. He was 36 years old and looked like every morning he had been whipped and beat.
Oh,
So I asked
yeah.
one of the other trip leaders, I said, does Jim snore pretty bad? Oh, it's horrible. Horrible. So one day at lunch, I said, dude, do you ever feel good when you wake up in the morning? Because never. I said, did it ever cross your mind that you could have obstructive sleep apnea? He goes, what's that? And so I hope he was from England. And I hope he went home and looked into it.
Yeah.
But it's out there.
Wow.
Do you ever do you ever prescribe hormones?
No,
No. Okay.
I don't feel like I'm, as an otolaryngologist,
Right,
qualified to prescribe hormones.
Totally fair. I mean, yeah, totally fair. But I just didn't know if you ever like used estrogen lozenges or sprays for the mouth.
So have I done it? Yes.
Yeah.
So we're going to probably talk about burning mouth syndrome.
Yes.
Thin, atrophic, mouth stings, burns. And usually it's a postmenopausal woman, mid-50s to, it seemed like it doesn't happen, well, on up into the 70s. And you look, no disease. but pale, thin mucosa everywhere. Tongueless, totally normal, just dry. And you try everything. And I knew it was an estrogen problem.
Yeah.
And so estradiol tablets are not water soluble. They're real hard, but they will dissolve eventually. And I would give women a 0.5 milligram estradiol tablet and have it dissolve in their mouth 3 times a week and come see me in 4 weeks and see what happened. Almost always it worked, but I was scared to death about vaginal bleeding, breast cancer,
I
breast
get that.
enlargement, all this stuff.
Sure.
And I'd say, okay, we figured out what the problem was. You ought to talk to your gynecologist. I should not be prescribing estradiol to you.
Right. Yeah.
But amazing that you did. I mean, I'm like, that's so great that you like
they
put
were
that all
desperate
together.
because their mouth burned.
Yes.
Everything was horrible. But you lushed up the oral mucosa with a little topical estrogen, just like you do with vaginal estrogen preparations.
Yeah.
But there is no swish. There is no oral estrogen preparation out there. So I just said, I'm going to try it.
Yeah.
And I haven't done it many times, but it
so
worked.
they can compound
so cool.
you a troche,
Sure.
like a lozenge.
Well, I've used compounded estrogen nasal
Yeah.
sprays before, and we'll
Yeah.
talk about eustachian tube function, all that in a minute. But
Yeah.
so someone will compound one.
Yeah.
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 Well, now I'm less worried about using it since the black box warning is off.
That's right. Yeah, I had a patient that was her. It was when we first started, like, doing this, and she came in, and that was her biggest complaint was my tongue is burning. I mean, she was in her 60s, so out of menopause a while, but that was her biggest thing was like,
and she tried everything. They told her it was thrush. They told her this, that.
yes, and she just was like, it burns. And I read on the internet that it could be my estrogen. I mean,
She was correct.
yeah. And I mean, thank goodness for the internet that these women are finally able to get themselves pointed in the right direction.
So this is the other crazy thing about burning mouth syndrome. The medicine that works the best is clonazepam.
Oh,
Wow.
Yeah.
So a long-acting benzodiazepine,
yeah.
it goes away. And so there is a neuropathic or neurogenic component to this.
Yeah.
Well, is there a neuropathic component to menopause? I mean,
Yeah. I think
Something
it's
is-
just like, all those
I mean-
brain receptors that are starving for estrogen.
yeah.
I think it really does crazy things in our brain.
but for the women that I can do nothing more for,
Yeah.
I'll give them 0.5 clonazepam, have them take one twice a day, and they'll call me in a week and say it's gone. It's the first time it's been gone in 2 years.
Wow.
And then I'm stuck.
You're stuck
Prescribing that forever.
Well, you just send them right on over here, and we'll talk to them all about estrogen lollipops.
Yeah.
Yeah.
There you go. Because that would help tremendously.
Yes.
Oh, that's amazing.
Estrogen lollipops. They'll make it. They'll put it. They'll put
I
it
don't
into
know if
the
they'll
stick.
put a stick on it, but they do make a lozenge.
The custom compounding guys. Yeah.
Yeah.
Tyler and Mark. Yeah.
Yeah. I mean, they call it a troche, but it is an estrogen like lozenge that you suck on.
Yeah.
Yeah. Just like a cough drop.
They need it.
Yep.
Good.
Okay, so let's talk about ear issues in menopause. I was reading all about this last week and over the weekend, but I love that somebody referred to the ear as a neurohormonal organ with receptors for estrogen, progesterone, and even androgens throughout the middle ear, the cochlea, the vestibular system, and the auditory brainstem. So, I mean, I've never really thought of our ears as hormonal. We do such a bad job at talking about hormones like ovaries, uterus, boobs. That's it. We don't talk about them in the ears, but women on hormone replacement often show improved hearing thresholds and reduced ringing, and estrogen deficiency is associated with accelerated age-related hearing loss and increased ringing in the ears. So yeah, let's talk about that.
So it's going to be difficult to really pinpoint that.
Yeah.
Because between genetics, too much rock and roll in the 60s,
Yeah.
worked in a factory,
Yeah.
whatever, noise exposure and genetics probably going to be the predominant thing. And so I've never thought about this, but it makes sense. And this is back, are there nerve-related effects of no estrogen? I'm wondering if we Google and start asking, can
Yes.
some women with no estrogen get peripheral neuropathy? they're getting neuropathic pain of the sensory nerves to their tongue from whatever reason, and benzodiazepines cool that off. And is this a peripheral neuropathy like symptom happening to the sensory nerve endings in the inner ear? I've never thought about it, never heard otolaryngologists discuss this issue.
Yes.
But does it make sense that it's one of the other things that could be affecting hearing in postmenopausal women? Absolutely. I would have to think it's a small contributor, but to some degree. And it says increase in ringing. This literature talks about that. Ringing is either irritated or damaged nerve endings in the inner ear, the hair cells, or as you get hearing loss, is it the processing centers that are getting irritable because they have less sound to process?
Right. Right.
And so it's hard to know. And if you're going through menopause and you have headaches and your muscles are sore or whatever, there's tight, tense muscles of your jaw, tight, tense muscles of your neck also can create a high-pitched sound in your ears. So tinnitus and hearing loss is probably all multifactorial, but is there people that are proving that there's a contributing factor? I don't doubt that. Yeah. But there's plenty of other reasons to have hearing loss and tinnitus. But could this be additive? Absolutely.
Yeah. I just keep going back to the vagina because that's what I do all day. But in the vagina, we know very well that if you take estrogen away from the vagina, you decrease the collagen, you decrease the blood flow, and you decrease the nerve supply. And so even if you're able to comfortably have sex, it feels different than it used to. And so we talk about that a lot in the vagina. So if it helps with nerve, almost that peripheral neuropathy in your vagina, then why wouldn't it help, in other areas? And so it really does make sense. But yeah, we know that estrogen and progesterone enhance the GABA firing. And so we talk about that a lot with anxiety. That's like our calming, part of that nerve response. And then I went way down the rabbit hole of like the estrogen glutamate connection. So glutamate is like the excitation firing. So if you take away estrogen, you get more of that glutamate response and then over excitation. And so in the auditory system, they were talking about that overly, exciting in that area may be the ringing in the ears. So, I think, that it's so interesting. And then I found a little study about these mice, but estrogen in the auditory processing center of the brain dampens noise. So the lack of estrogen makes you more sensitive to certain noises. And then that made me think about is that why certain sounds are annoying or I'm easily overstimulated? Or is that just because I've got, kids and a husband and everybody running around and overstimulating me?
If you're good at this at 45, when you go through menopause, you're going to be really good at this.
I know. But, and then they were these little mice and they did knockout mouse. So for people listening, you may not understand what that means, but you can make someone's gene defective on purpose. And so in these little mice, they made their estrogen receptor beta, kind of defective on purpose. And they found that mice lacking estrogen receptor beta had greater cochlear damage after noise exposure. So that just
makes
kind
sense.
of led them to believe that estrogen in particular may have a protective role.
It likely keeps everything healthier.
Yes.
And what about the retina and vision and the optic pathways?
Yeah.
I wonder about that.
Yeah.
Is the incidence of macular degeneration that higher in women with no estrogen? I wonder. I've never looked.
Right.
Sure,
but some of these eye diseases that women get, is the incidence higher if they have no hormones? You wonder.
Yeah. We know for sure, in pregnancy,
Mm-hmm.
the curvature of the lens changes. People's eye prescription, their glasses prescription may change. And we're always I wouldn't go get a whole new prescription. They're going to go back after you take all that estrogen away. And so it's probably, I would wait and get the eye exam and the new glasses after you have the baby rather than right now. And then probably again after you have the baby. But
Well, the eye connection is something for us to read about.
I know, and maybe be on our head to toe series here.
Yeah.
But yeah,
We need to get an ophthalmologist in here next.
yeah, and then I feel like we got to touch on like vertigo, dizziness, because I feel like that's a common thing that we hear about. And
I
again,
feel like I
don't
hear
know
that a lot.
if it's just more common as we get older, or is there a connection there too?
So I haven't thought about that one.
Mm-hmm.
Vertigo, true spinning.
Mm-hmm.
The sensation of motion is either positional vertigo, you got some little crystals floating around one of your canals. You have a history of migraines since you were 18, and you've had visual disturbances. Well, if that migrainous phenomenon affects that part of your brain that controls your balance, you have days where you feel off kilter and dizzy. So there's maybe an association with menstrual cycle. I think most people have thought that after menopause, the frequency of migraines goes down because these hormone levels fluctuate less.
That's right.
So you got positional vertigo, migrainous vertigo, and then Meniere's disease, which may be a migrainous thing. Nobody really knows, but it's elevated fluid pressures in the fluid-filled chambers in your ear, and some of that can be hormone-related. I've had a few women over the years. Every month, they would feel fullness pressure and ringing in the ears with the fluid retention changes that went along with their menstrual cycle. I give them a little diuretic. They can feel it coming on. They take a diuretic for 4 or 5 days, and the ear symptoms will go away.
Yeah.
It's pretty rare. I've only had 5 or 10 women who got ringing and fullness in the ears related to their hormones during their menstrual cycle. And then the last thing is acute vertigo attack that people go to the emergency room for. They just wake up during the night and the room's spinning and they're throwing up. It's called vestibular neuritis, and it comes and goes on its own. So what relation does hormones have with any of those things? I can't, other than the migrainous thing, I really can't blame any of the others for hormone issues. But the other dizziness complaint is I feel lightheaded, I feel weak. That's usually when your heart rate or blood pressure is too low. People are on beta blockers, they're on all kinds of medicines, and they come to that. Every time I stand up, I'm dizzy-headed, and they call it, I have vertigo. Well, in reality, their heart rate or their blood pressure is too low when you stand up.
Sure.
Yeah.
And then the other thing that's frequently lumped into dizziness is imbalance, and that's back to the peripheral neuropathy thing. Your balance has nothing to do with your inner ears, has to do with your vision, your ability to orient yourself. You're falling, you can see it happening, but it's your sensory receptors in your feet, ankles, knees, and hips. If you start leaning to the right, you feel that pressure, that sensory impulse is sent to the brain processes, sends a message back to the muscles to push you back. Well, if you have any peripheral neuropathy, you start becoming less balanced. It happens to all of us as we get older, the sensitivity of that. But diabetic peripheral neuropathy raises the question, if postmenopausal women, what is the incidence of peripheral neuropathy in women who have hormones and don't, Is it higher? And if so, do those women prematurely feel less balanced?
Yeah.
I don't know the answer to that.
I know, and I think there's going to be more
cool.
now that we've lifted the black box. I mean, nobody wanted to study this, right? Because it's like, well, I mean,
There's a black box
there's a
on
black
it,
box
so
warning.
there's no point.
Yeah, we're not going to study estrogen, but I think now with that being lifted, hopefully that's going to translate to more studies, more funding, all of that.
So if you go to a neurologist and you have peripheral neuropathy and they can't find a cause, what do they call it? It's idiopathic peripheral neuropathy.
Oh, yeah.
So you wonder, in those men, have they had zero testosterone for 20 years?
Yeah.
And those women have had zero estrogen for 20 years?
Yeah.
Yep.
And there's some percentage. I mean, that's something else I'm going to look up.
I know. It's just
I never thought about that, but it's idiopathic. But why? What triggers it? What leads to this demise in your balance? And one wonders about this issue.
Again, can it just be on the list? Can it just be a bucket? Like, everyone that has peripheral neuropathy is not like, oh, it's because you're in menopause. I mean, that's definitely not the answer, but it's on the list, I think, probably.
I agree.
Yeah.
I'm going to look it up. Hopefully somebody out there has put two together.
Yeah. And then I just have a question, because I have to know, do you make more or less earwax as you get older?
Dramatically less.
Less?
Oh, she's making more
I'm
of it here.
I'm making more. And I just was like, I know he's gonna confirm that this is.
Well, you're talking about older. After menopause and andropause, all of that slows down.
So maybe it's my perimenopausal estrogen swings.
Could be.
I mean, estrogen going on.
Not necessarily like right now, but there are times where I'm like, what in the heck?
Mm-hmm.
And you probably hate to hear this. I clean my ears with the Q-tip every day when I get out of the shower.
If you can get away with it, and probably 3/4 of people can.
Yeah.
But now if you waited 6 months and had an ear full and went after it with that Q-tip, you were just packed up.
Push it in there.
No,
Yeah.
So I tell people all the time, I say, you have the type of ear. If you clean yours once a week, you can stay ahead of this. Swirl it in there, push down, pull out, flip it around, swirl in there, push up, pull out. Do that once a week.
Feels so
You'll
good.
be fine. But
Love
if you have
it.
a real small ear canal, it ain't going to work. You're just going to
You're
shove
just going
it
to
in
push more in there.
I love cleaning my ears.
Yeah.
I think it makes me feel like next level
So
of clean.
you're going to really like it if you were postmenopausal women. They love messing with ears because they itch. The
Yeah.
skin gets so dry, and the skin of the medial canal is paper thin, overlies the bone, and if it gets dry, it cracks, feels chapped, and they come in with this, my ear's bugging me, it itches,
Mhm.
and it's just real dry, chapped skin down there. The eardrum looks totally normal.
So what do you give those people?
Put estrogen cream in their ears.
Yeah. Squirt it in there.
Mineral baby oil. Once a week, just fill up your canal full of oil, let it soak in.
Yeah.
The ones that have some eczematous or psoriatic component to it, a little topical steroid oily drop.
Mm-hmm.
And the ones that have really bad eczema of the ears, and these are younger people, a steroid ointment. They swirl a Q-tip in the film and go down there, and
I think our dog must have had that. We had this dog with he's gone now, but he had chronic ear infections.
You should have put a little oily.
I used to wonder if it was
drop in
because
his ears.
he was neutered, and I'm like, maybe he just should have kept his.
Everything is related to no hormones.
He should have kept his hormones. I mean,
that's the way our brains work now.
I think about that. Yeah, we got a puppy, and it was like, well, it's time to neuter him, and I'm like, I actively sit and talk to women all day long about needing hormones, and now we're going to cut his hormones off. Like, that feels so wrong. And I asked the vet,
His ears dried out.
Yeah, I asked the vet, is there any research here that we're prematurely taking the dog's testosterone away? And I mean, she did say that you're not supposed to do it when they're less than 6 months old because you can prematurely close their growth plates. On like big breeds like labs and stuff. I mean, we have a miniature schnauzer, but she was kind of looking at me like I was a little bit crazy.
Yeah.
Because I was thinking about the dog's testosterone.
Well, a lot of people are going to listen to this podcast and think we're all three crazy.
That's fine. That's fine. We're not going to have dry ears. I'm going to snore less. I'm going to be able to, I can't sing, so it probably doesn't matter, but I'm not going to have voice changes. But yeah, so I think it's important for women to hear this and think about when should they come see someone like you, or when should they seek help? What is part of just this is quote unquote natural, and when should we reach out for help?
Well, they're going to come to me or to an ear, nose, and throat doctor when the allergist hasn't done anything and their primary care doctor hasn't done anything, or what they've done hasn't helped or made it worse.
Yeah.
So you wrote a list here, and let's go through this list. Recurrent sinus infections. By itself, this is not going to cause sinus infections. But if you catch a cold, which is the best way to get a sinus infection, a virus tears up your nose. The main pathologic event is all the cilia that move mucus for you are wiped out. You quickly realize how much mucus you make when it doesn't clear.
That's right.
And so you start pulling more mucus out, all of this thick drainage all the time. And if bacteria start colonizing those stagnant secretions, particularly back of the nose, you start getting some discolored secretions. And that's still not necessarily a sinus infection. That could just be some colonized mucus stuck in the nasopharynx. But if 2 or 3 colds back to back, mothers of young children, kids go to daycare, they get 3 or 4 colds back to back, their noses stayed inflamed and irritated from viral infection after viral infection, all the cilia are wiped out. Could they eventually get some stagnant mucus in one of their sinuses that gets infected? Then they're blowing yellow green crud out all day, have this kind of burn pressure sensation in here. And the statistics have said only 5% of viral illnesses lead to a sinus infection. Well, it makes sense to me. If you have thick mucus because you're dried out.
Mm-hmm.
Your chances of getting a stagnant mucus that becomes infected is a little higher.
Yeah.
So if you talk about recurrent sinus infections, being low on hormones isn't going to cause you to have a sinus infection. But if you catch a cold, you're more likely going to see nasty secretions because they're so thick, they don't clear, they accumulate, and the bacteria start calling those secretions. And get on antibiotic for a few days. Doxycycline is the best. 2 or 3 or 4 days of doxycycline, it all clears. And then you wait week after week after week for your cilia to go back. You can feel totally fine a week into a cold, but no, you still have this congestion and drainage. The next week, it's better. The next week, it takes 3 to 6 weeks, depending on how bad the virus was, before your cilia go back.
Wow.
And you can go, I don't have all that drainage anymore. It's because it's clearing normally again. But what if you catch another virus before you ever heal up from that one?
Right.
2 or 3 of those, then you may end up with a sinus.
Well, and how much should we call something a sinus infection when it's not? I feel like people say that. People say that all the time, and really, maybe it's what you're talking about. You don't have a sinus infection; you just have poor function of your cilia and more mucus.
Recurrent viral infections. You wake and feel terrible. You still have a sinus infection. You may have horrible obstructive sleep apnea. Any of those things.
Yeah.
Worsening headaches, other than just being frustrated and mad because you feel so bad. I don't know any direct correlation there. So the severe nasal dryness and bleeding, and you go down here about things to try.
Right.
So the severe nasal dryness leads to a very, very stuffy, congested nose, and it's difficult. And the most common thing is to use saline nasal spray. So I want you to squirt and rinse your nose out with saline nasal spray and tell me what it feels like 30 minutes later. It feels stuffy and congested. You've rinsed out what little normal mucus you have. And as that saline solution evaporated, it creates a dry, stuffy sensation. So nasal saline sprays are not moisturizers, as everyone thinks. They're rinses, all right? So if you have a cold and no cilia working and have all this stagnant mucus, rinse with saline spray.
Ooh, how do you feel about neti pots?
If you're sick, great. If you do it all day, every day, you're just rinsing out normal mucus, and it can't be good for your mucosa.
I love a neti pot when I'm sick. When
you're sick, to get out stagnant mucus.
Yeah.
But when you're healthy, you don't do anything to your nose. But a dry nose is not a healthy nose. So how do you make it more moist? So 1, long, hot, steamy showers. 2, don't sleep under a fan. 3, the hot, wet wash rag trick. 4, bath trace and ointment to lube up your nose at night.
Yes.
Oily nose drops, if someone feels comfortable prescribing them, and there's a couple of pharmacies in town that still make those, and there's going to be a lot of people around the country who say I would never do that because it's going to get in the lungs and cause problems with the lungs, but I've never seen it. And then you discourage them from using Flonase, antihistamine nasal sprays, get off of all of that, and their nose starts feeling better.
What about Afrin?
So Afrin is a strong vasoconstrictor. It shrinks down the tissues in the nose and you breathe great. If you use it for more than a week, 2 or 3 times a day, it starts tearing up the lining of the nose. You get this horrific rebound congestion, and it wears you out. So if you're sick with a cold and horribly congested at night, and God, I've got to be able to breathe through my nose, hit it at night before you go to bed for about 4 or 5 days, and then quit. But to use it situationally, it's fantastic. If you have a nosebleed, squirt some Afrin there to quit. It constricts the blood vessels.
Yeah, I love Afrin when I'm sick, but I always feel like a little bit like guilty when I'm using it. Like, should I be using this?
No, use it once.
Too much of this isn't good.
Use it at night for a week when you're the worst congested. That's no problem. It's a great medicine. Great medicine.
Yeah. All right.
But humidifiers make sense. But if you have central heat and air, they're not going to do very much. Because as soon as your heat and air kicks on, the humid air gets sucked down the hall and you return air and comes out dry again. So you'd have to shut the vents in that room and, put 2 of them in there because our homes are much tighter than they were 30 years ago. Our heat and air units are dramatically more efficient. And so the indoor air environment's dry.
That's right.
So it really bothers these.
I always notice that in the winter, that when you turn the heat on, it's like
everything's dry.
So if it's 0 degrees outside, the heat's running all night long, you wake up stuffy and congested. That little bath trace and ointment on a Q-tip works great.
Oh,
this was great advice going into cold and flu season.
I'm telling you, it is. Yeah.
Well, I can't thank you enough for coming. I know you probably felt like you were stepping out of your lane a little bit to come over here, but We appreciate that.
So
I
much.
appreciate people not thinking we're the crazy hormone people over here. We're trying to practice evidence-based medicine. And I think, having somebody like you who's been around a long time, obviously very well respected in the community, just kind of solidifies that for us. So I appreciate it so much.
Absolutely.
Well, I'm excited for the women that y'all have come around.
Yes. And I really
and are
never
doing
knew.
this because to do it is horrifically time consuming, and have a passion to help. You're going to have to figure out the balance there.
I know, yes. But I just never knew that ENT issues may kick up with menopause. I really never even knew a direct, never dug down for that scientific connection. So this was all so interesting to me. And I love having better answers than we're just getting old. I really hate that to be the answer. So I think we may try to dive into some of the mast cell activation stuff and just have a podcast just talking about mast cell stuff next, because I know in our world, the hormone world, that stuff is trending big time out there and people are wanting to hear it. So I think we may talk about mast cell stuff. But yeah, if you need to see Dr. Hernsberger, he practices here in Little Rock. Are you still in the doctor's building? Yeah.
35 years.
Yeah.
Wow.
So what was that, the fourth floor? I'm trying to remember.
I'm on the fourth floor. I was on the second floor for about 15, 20 years, and now I'm on the fourth floor. Yeah.
So
Nice.
But I'm slowing down.
Yeah.
So I'm glad to share all this information before I
impart your knowledge.
Yes.
But he's here in Little Rock. You can come see us. Obviously, here in Little Rock, we are not ear, nose, and throat doctors, but we can talk to you all about the hormone side of things. And so don't forget to subscribe, share this episode, tag a friend who's been complaining about their new snore or their runny nose.
Or their ringing ears.
Their ringing ears, yeah.
And just a quick reminder, everything we talk about here is for informational and supportive purposes only and is not medical advice. No doctor-patient or provider-patient relationship is established on this format. Your